Dear friends, so now we will discuss about compliance. So it will be discussed in three topics: compliance of lung, compliance of chest wall, compliance of lung and chest wall, then compliance of lung during inspiration and compliance of lung during expiration. So first of all, what is compliance? What is compliance? It is a very important topic, very VIP topic. Because it is VIP topic, so it is delta V by delta P. Because it is VIP topic, so it is delta V by delta P. And what is elastance? This is compliance. What is elastance? Elastance is opposite of compliance. It is delta P by delta V. So it is inversely proportional. Compliance is ease of expandability. Suppose there are two balloons. One is thick balloon, other is thin balloon. So thick balloon will be less compliant and thin balloon will be more compliant. So thick balloon will be more elastic and thin balloon will be having more of compliance. Okay. So we will draw a diagram of compliance. Delta V by delta P is called as compliance. This is 0 mm Hg plus 20 mm Hg minus 20 mm Hg. This is residual volume, functional residual capacity, total lung capacity. Okay. Now, as we know, the basic property of lung is to expand. Because basic property of lung is to expand. Basic property of lung is to collapse and property of thorax is to expand. So one want to collapse and one want to expand. So if we cut pleural membrane, compliance of lung will be different and chest wall will be different and total respiratory system will be different. So just imagine that we have cut pleural membrane and lung is sequestered. Then lung will collapse. So at 0 mm Hg pressure, volume of lung will be what? It will be 0. Volume of lung will be 0. And if we fill air in the lung, it will occupy what? Total lung capacity. It will occupy how much? Total lung capacity. As we know, maximum volume of lung which it can be occupied is total lung capacity. So basic property of lung is to collapse. So if you put lung separate, if you put lung away, it will collapse and occupy 0 volume. And if you fill air in that lung, as we all know, maximum capacity is total lung capacity. So this is compliance of lung. This is compliance of lung. And as we know, basic property of thorax is to expand. So it will occupy this much area. And if we put air in that thorax, it will become total lung capacity. And if you squeeze the air from the thorax, it will become how much? Residual volume. So in this condition, it will be somehow like this. Minimum is residual volume, the chest wall. So this black diagram is compliance of chest wall. And normally when we are sitting over here, lung and thorax both are together. And what is normal equilibrium volume? It is functional residual capacity. When you are neither inspiring nor expiring, like this, how much air is present? Functional residual capacity. And if you inspire, total lung capacity. When you expire, it is residual volume. So if you talk about this normal curve, it is functional residual capacity. So this is compliance of total respiratory system. So this diagram is very important because this diagram is, suppose my speed is fast and my colleague has slow speed of walking. Okay, so my speed will be something else. My colleague's speed will be something else. But if both are walking together, then speed will be something else. I will decrease my speed and he will increase the speed. Similarly, basic property of lung is to collapse and property of thorax is to expand. But when lung and thorax are together, both will compromise. And this is compliance of total respiratory system. So again, if we put lung and thorax differently, lung will collapse and thorax will expand. This is normal. This is normal functional residual capacity when lung is along with chest wall in living condition. Normally, when lung and chest wall both are together, then this is normal functional residual capacity. If we put lung differently, it will decrease to 0. And if we put thorax differently, it will expand to 60% of total lung capacity. So when lung and thorax are together, it is functional residual capacity. When lung is different, 0. Thorax is different, it is 60% of total lung capacity. And when you fill air in the lung, it will become total lung capacity. When you fill air in the thorax, total lung capacity. And when you squeeze thorax, it will become residual volume. So this is the compliance of lung, thorax and lung in the thorax. Okay. Now there is one more curve called as compliance curve. There is one more curve which is called as compliance curve. We make a diagram delta V by delta P. This diagram will be somewhat like this. This is air. There is inspiration. When we are inspiring, compliance is different, and when we are expiring, compliance is expiration. When we are expiring, compliance is different. So this difference in the compliance during inspiration and expiration is called as hysteresis or hysteresis loop. So this is called as, what this is called as? This is called as hysteresis. Sometimes it is asked, what is hysteresis? Compliance of lung is different during inspiration and during expiration is called as hysteresis. You can see in this diagram, delta V by delta P is called as compliance. And during inspiration, curve is different. During expiration, curve is different. Now you can see at the same pressure, volume is different during inspiration and during, this is volume during inspiration, this is volume during expiration. So what hysteresis mean? Volume during inspiration is less than volume during expiration. So we can see here that volume is different during inspiration and expiration. It is less when we inspire. It is more when we expire. So your lung is behaving differently during inspiration and expiration, and this phenomena is called as hysteresis loop. This term is taken from physics, from engine. This is also a term in the physics called as hysteresis loop. Similar thing is happening in your lung also. It is behaving quite differently during inspiration and expiration. Now, last year this was asked, what is the cause of hysteresis? Can you tell me the cause why it is behaving differently? Why volume during inspiration is less and volume during expiration is more? Now see, let me explain this phenomena. This is a very important thing. Suppose during inspiration, what is happening? What is happening during inspiration? Suppose this alveoli is smaller and this will become bigger. So smaller during inspiration, it has to become bigger. So alveolar, if they are smaller, will have less collapsing pressure or more. Smaller the alveoli, more will be the collapsing pressure. So point number 1, collapsing pressure is more during inspiration because alveoli are smaller. Number 2, because collapsing pressure is more, surface tension is also more. Collapsing pressure is more, surface tension is more. But what about surfactant? Surfactant was stored in the form of lamellar bodies. Then they form tubular myelin, and then they form surfactant, and then decorate inside the alveoli, isn't it? So, what about surfactant? It takes some time to come outside. When we inspire, it takes some time to come out. So, during inspiration, surfactant is low. So, surfactant is less during inspiration. Because surfactant is less, but surface tension is more. So, volume will be less or more? Volume will be less. Volume will be less. Why volume will be less? Because property to expand is less because surface tension is more, and the surfactant which is helping it to expand is less. So volume will be less. Volume want to be expanded, but because surfactant is less, so volume is less during inspiration. Because of surfactant is less during inspiration. Now what happened during expiration? What happened during expiration? Alveoli are initially bigger, it has to become smaller. So collapsing pressure of bigger alveoli will be less or more? Less, because radius is more in comparison to small alveoli. Surface tension will also be less, but because surfactant took some time to go inside, so surfactant will be more or less? Surfactant will be more. Surfactant will be more. So volume will be less or more? Volume will be more. So now you can see volume during inspiration is less and volume during expiration is more. So what is the cause here? You can see it is difference in concentration of surfactant during inspiration and expiration, what is causing hysteresis. So cause of hysteresis will be what? Cause will be difference in concentration of surfactant during inspiration and expiration. Cause of hysteresis is, it is asked in previous examinations, difference in amount of surfactant during inspiration and expiration. So it is not alveolar pressure which is different, but it is amount of concentration of surfactant which is different during inspiration and during expiration, which causes this hysteresis. Now there is one more term which is very important to understand, and that is what is specific compliance. What is specific compliance? Now see, if there are two balloons, one do not have any air and one have few air, ease of expandability will be more which is empty or which have some amount of air in it. Of course, the balloon which has some amount of air in it will be easily expandable. So compliance will be more. What is compliance? Compliance is ease of expandability. So more easily you can expand the balloon, more will be the compliance. Similarly, what is the amount of air in the lung? It is functional residual capacity. If one has more FRC, other has less FRC, compliance will be more of a person who is having more FRC. This is biased. So you cannot compare compliance of lung between A and B. So to compare specific compliance of lung, you have to unbiased FRC. And for that, to calculate specific compliance, you have to divide compliance by functional residual capacity. So it will be compliance upon functional residual capacity, because compliance is more in bigger lung. So this is lung compliance independent of lung. This is lung compliance. This is lung compliance independent of this is called as specific compliance. Okay. Now there are different terms to understand like alveolar ventilation, minute ventilation, maximum voluntary ventilation, breathing reservoir. So we should know all these terms also. So number one, what is alveolar ventilation? What is alveolar ventilation? As we know that there is anatomical dead space which is not taking part in gaseous exchange. So it is not that amount of air which is taking participate. So if you want to calculate the amount of alveolar ventilation, you have to minus the amount of anatomical dead space from tidal volume. So that will be tidal volume minus anatomical dead space into rate of respiration. It is approximately 12. So it will be 500 minus 150 into 12. So approximately it is how much? 4.2 liter per minute. This is called as alveolar ventilation. Now what is minute ventilation? Second term is what is minute ventilation? What is minute ventilation? Minute ventilation is tidal volume into respiratory rate. It is irrespective of anatomical dead space. We just are calculating what is the amount of air we are exchanging per minute. It is 500 into approximately 12. It becomes 6 to 7.5 liter per minute. This is minute ventilation. Now third is what is maximum voluntary ventilation. What is the maximum amount of air you can voluntarily ventilate? It is maximum voluntary ventilation or MVV. Can you guess amount of air which you can maximally ventilate per minute? It is 120 to 170 liter per minute. Okay, if you voluntarily maximum voluntarily ventilate, the amount of air which you can ventilate is 120 liter to 170 liter per minute. This is called as maximum voluntary ventilation. And the fourth term is what is breathing reservoir? What is breathing reservoir or dyspnea index dyspnea index is equal to maximum voluntary ventilation minus minute ventilation upon maximum voluntary ventilation into 100. It is maximum amount of air which you can inspire and expire above pulmonary ventilation is called as breathing reservoir or dyspnea index. Normally it is 70 to 90%. Normally this much reservoir is left. That is why dyspnea is not occurring. But if become less than 60%, then dyspnea can occur. Okay. Now one more thing. We have discussed already V by Q ratio. We have discussed that it is maintained because of surfactant. Now what is V by Q ratio in apex, at base and at the mid? First of all, ventilation is maximum at apex or base? Ventilation is maximum at base. Why? Because alveoli are not bigger, they are smaller. Smaller the alveoli, more will be the ventilation. And here alveoli are bigger. So ventilation is maximum at the base because alveoli are smaller. What about perfusion? Perfusion is maximum where? At the base or apex? Perfusion is also maximum at the base. Because of gravity, all blood will go to the base of the heart, not to the apex. So maximum blood supply will be to the base because of gravity. So ventilation is maximum at the base. Perfusion is also maximum at the base. What can be the reason? Reason is that all blood is going maximally to the base, not to the apex because of gravity. But what about V by Q ratio? Is this maximum at the base or apex? It is maximum at apex. Can you tell me the reason? Yes. What can be the reason? Ventilation is less at apex, but perfusion is very less at the apex. So ratio is more at the apex. So ventilation is maximum at base. Perfusion is maximum at base. But ventilation perfusion ratio, it is maximum at apex. Because although ventilation is less at the apex, but perfusion is very less. So denominator is less, so ratio will be more. And what is the value? You should remember value is also 3.3, 0.8 and 0.6.